Signs of blood clots in legs. Imagine this: you're breezing through your day, feeling perfectly fine, when suddenly, out of nowhere, you notice a strange heaviness in your leg. It seems harmless, right? But what if this seemingly innocent sensation is your body's silent cry for help, warning you about a lurking danger? Blood clots in the legs, or deep vein thrombosis, DVT, are hidden dangers that can strike without warning and lead to life-threatening complications. Shockingly, 1 in every 1,000 people develops DVT each year, with risks soaring for those over 60 or with certain health conditions. What's scarier? Many people don't notice until it's too late. That's why today, we're uncovering 12 critical warning signs of blood clots in the legs, signs that could save your life or someone you love. Whether you've been sitting too long, traveling, or just feeling off, this knowledge is your best defense against a silent killer. Let's dive in and arm ourselves with life-saving awareness. First up is swelling. Swelling in the legs can be a bit concerning, especially when it happens suddenly. When we talk about swelling linked to blood clots, it's often a clear red flag that something isn't quite right. So, how does this swelling occur? Well, it starts when a blood clot forms in a vein, blocking the normal flow of blood. Imagine the blood trying to rush through a crowded hallway. When a clot gets in the way, it creates a traffic jam. This buildup of blood leads to pressure in the veins, causing fluid to leak into the surrounding tissues. That's when you notice your leg looking a bit puffed up or feeling unusually heavy. Now, let's talk about why this pressure difference happens. In a healthy leg, blood flows smoothly back to the heart. But when a clot blocks that path, it disrupts the flow, leading to a backup of blood. This pressure builds up behind the blockage, making it hard for the blood to get where it needs to go. As a result, fluid spills out into the tissues, leading to that uncomfortable swelling you might be feeling. It's your body's way of signaling that something is off, so pay attention. It's essential to know how to distinguish clot-related swelling from other types of swelling that can happen for various reasons, like an injury or just sitting for too long. One key difference is the suddenness of the swelling with blood clots. If you notice that one leg has swollen up quickly, maybe within hours or days, while the other looks normal, that's a sign to take seriously. Plus, clot-related swelling often comes with other telltale signs, like warmth, redness, or even pain in the affected area. If you experience swelling along with these symptoms, it's time to reach out to a healthcare professional. Now, let's explore the next sign: pain or tenderness in the legs. If you've ever felt a dull ache or a cramping sensation, especially in your calf or thigh, it might just be your body trying to tell you something important. Many people describe this feeling as similar to a pulled muscle, which can make it easy to brush off at first. But here's the thing: if the discomfort doesn't ease up with a little rest or if it starts to intensify, that's when it becomes a warning sign you shouldn't ignore. When a blood clot is present, it can cause pain by putting pressure on the surrounding tissues and nerves. This is your body's way of signaling that something isn't quite right. Imagine trying to walk around with a heavy backpack. After a while, it starts to weigh you down and can lead to discomfort. Similarly, the presence of a clot can make your leg feel achy or tender, especially when you try to move it or put weight on it. It's important to pay attention to how the pain feels and when it occurs. For instance, if you notice that the ache becomes more pronounced when you're active or if you experience tightness that feels different from your usual muscle soreness, that's a good reason to take a closer look. Many people make the mistake of attributing leg pain solely to overexertion or exercise, but if it's persistent and doesn't seem to improve, it's time to consult a healthcare professional. Remember, the key here is being aware of what your body is telling you. While some muscle soreness is perfectly normal, any unusual or escalating pain could indicate a more serious issue like a blood clot. Don't hesitate to reach out for advice. Catching these signs early can make a world of difference in your health and well-being. Another important sign to watch for is redness or discoloration in one leg. If you notice that one leg looks redder or has a noticeable change in color compared to the other, it could be a signal that something isn't quite right, possibly a blood clot. This discoloration often occurs because the body is responding to the blockage in the vein. When a clot forms, it can cause inflammation in the surrounding tissues, leading to that reddish hue. This change in color can be subtle at first, so it's essential to pay attention to any differences. You might find that the affected area not only appears red but may also feel warmer to the touch. This warmth is another indicator that inflammation is taking place, which is the body's natural response to injury or infection. Just like when you accidentally bump your knee, and it swells and turns red, a blood clot can cause similar reactions in the veins. Thinking about what to do if you're seeing these signs? It's crucial to consider what else might be happening. For instance, if you experience redness along with other symptoms like swelling, warmth, or pain, it's a strong indication that you should consult a healthcare professional. Remember, while some redness in the skin can be harmless, such as after a workout or from sitting too long, if it appears suddenly and is localized to one leg, it's worth investigating. In some cases, you might notice increased warmth in one of your legs, which can be another sign of a blood clot. This warmth often occurs in a specific area, making it feel different from the rest of your leg. It can be a bit concerning, as this sensation can resemble what you experience when you have an infection. However, it's essential to differentiate between the two, as they may require different responses. When a clot is present, the body reacts to the blockage by increasing blood flow to the area in an attempt to promote healing. This can lead to a feeling of warmth that might be localized to the spot where the clot is situated. You might describe it as a hot sensation that feels unusual compared to your typical body temperature. It's like having a cozy blanket wrapped around that part of your leg, but it can also be a warning sign that something isn't right. To help distinguish this warmth from an infection, consider whether you're experiencing any other symptoms. For example, an infection might be accompanied by fever, chills, or more widespread redness and swelling. On the other hand, warmth associated with a clot usually comes along with other signs, such as swelling, tenderness, or pain in the leg. If you feel warmth in your leg, especially in conjunction with any of these other symptoms, it's a good idea to reach out to a healthcare professional. Next, let's discuss changes in the appearance of your veins, which can be an important indicator of your vascular health. If you notice that your veins appear more prominent or have a twisted, bulging look, it's definitely something to pay attention to. Blood clots can lead to increased pressure in the affected veins, causing them to swell and become more visible just beneath the surface of your skin. Imagine a garden hose that's kinked or blocked. When you turn on the water, the pressure builds up behind the obstruction, causing the hose to bulge out in unusual ways. The same principle applies to your veins when a clot forms. The obstruction can cause blood to pool in the affected area, leading to a visible change in the vein structure. You might notice that one leg has veins that are not only more pronounced but could also look a bit distorted or twisted, which can be a sign that something is going on beneath the surface. Other symptoms, such as swelling, pain, or tenderness in the leg, often accompany this change in vein appearance. While some people naturally have more visible veins due to factors like genetics or body composition, a sudden change, especially if it's localized to one leg, should raise a flag. If you see bulging veins that are not just your typical anatomy and they come with discomfort, it's a good idea to consult a healthcare professional for a thorough evaluation. Shortness of breath is another significant sign to watch for when it comes to blood clots, particularly if a clot has traveled to the lungs, causing a pulmonary embolism. This can happen if a clot from the leg breaks loose and moves through the bloodstream, creating a blockage in the pulmonary arteries. If you suddenly find yourself feeling breathless, experiencing a rapid heart rate, or feeling lightheaded, it's crucial to seek medical attention right away. These symptoms can be alarming, and it's essential to understand that they could indicate a serious situation. When a blood clot obstructs the flow of blood to the lungs, it can restrict oxygen supply, leading to that uncomfortable feeling of not being able to catch your breath. You may feel like you've just run a race, even if you've been sitting still. It's important to recognize that this isn't just regular fatigue or shortness of breath after exercise, it's a sign that something may be very wrong. Along with breathlessness, you might also notice sharp chest pain, especially when you take deep breaths or cough. This pain can be similar to the sensation of a pulled muscle, but it's often more intense and persistent. Another sign to be aware of is the feeling of heaviness in the leg. If you suddenly notice that one leg feels unusually heavy or fatigued, it could be a sign of a blood clot. This sensation often arises because the clot can impede normal blood flow, making the affected leg feel weighed down. It might feel as though you've been standing all day, even if you haven't moved much. This heaviness can be quite uncomfortable and is often accompanied by other symptoms like swelling or pain. The feeling of heaviness can be especially concerning if it comes on suddenly or is accompanied by other signs of a clot. Your body relies on proper blood circulation to function well, so any blockage can disrupt that flow and lead to this unsettling sensation. If you're feeling a pronounced heaviness that doesn't improve with rest or is paired with warmth, redness, or tenderness, it's important to seek medical advice. Ignoring this sign could mean missing out on early intervention that could prevent complications. Next, let's discuss the impact on mobility. If you find it difficult to walk or move your leg as easily as you usually do, it may be related to a blood clot. Many people notice stiffness or a limited range of motion in the affected leg, which can make it challenging to perform daily activities. This change in mobility can be quite alarming, especially if you haven't experienced any prior injuries or strains. When a clot is present, it can lead to discomfort that makes you hesitant to move your leg. You might find yourself limping or avoiding putting weight on that leg altogether. This decreased mobility can be frustrating, but it's your body's way of signaling that something is wrong. If you notice this change, particularly if it's sudden or accompanied by swelling, pain, or warmth, it's essential to reach out to a healthcare professional. Another crucial sign to watch for is a change in skin texture or temperature. If you notice that the skin over your leg feels unusually warm, cool, or even cold to the touch, it can indicate a problem. For instance, a leg affected by a blood clot may feel warmer in the area of the clot due to inflammation, while the surrounding skin could feel cooler if blood flow is restricted. This contrast in temperature can be a significant warning sign that something isn't right. Additionally, changes in skin texture can occur. You might observe that the skin looks shiny, tight, or even slightly puffy in the area surrounding the clot. This happens as the body reacts to the clot, which results in inflammation. Pay close attention to these changes, especially if they occur alongside other signs like swelling, pain, or redness. If you notice any unusual skin changes, it's essential to consult a healthcare professional promptly, as this could indicate a need for further investigation. Another sign to be mindful of is persistent or worsening leg cramps. While cramps can occur for various reasons, if you're experiencing them frequently in one leg, particularly in the calf area, it could be related to a blood clot. Unlike typical muscle cramps, which usually ease with gentle stretching or movement, the cramps associated with clots may feel more intense and persistent. They can sometimes mimic the sensation of a Charley horse, making you feel like the muscle is tight or knotted. If you find that your leg cramps are becoming more frequent or are accompanied by swelling, tenderness, or warmth, it's crucial to seek medical advice. Ignoring these signs could lead to further complications, so taking them seriously is essential for your health. Additionally, keep an eye out for unexplained fever or chills. While these symptoms can be associated with various conditions, if you're experiencing them along with other signs of a blood clot, it may warrant further investigation. A low-grade fever can occur when there's inflammation in the body, which might happen with a clot. This can sometimes be accompanied by chills or a general feeling of being unwell, making you feel a bit off balance overall. Lastly, let's discuss one of the more alarming signs you should never ignore: the presence of a warm, swollen area in your leg that feels tender to the touch. This symptom can be a clear indicator that something serious is happening beneath the surface, and it often warrants immediate attention. When a blood clot forms, it can cause inflammation in the surrounding tissues, leading to localized swelling that feels warm and painful. Imagine touching a freshly baked loaf of bread. When it's warm and soft, you can feel the heat radiating from it. Similarly, a warm area on your leg can signal that blood flow is disrupted due to a clot, which causes inflammation and an increase in temperature. If you gently press on the swollen area and feel pain, that's your body's way of telling you that something isn't right. It's essential to act quickly in these situations. Pain in a warm, swollen area can sometimes indicate that the clot is causing significant issues, and delaying treatment could lead to serious complications, such as a pulmonary embolism, if the clot travels to your lungs. If you experience these symptoms, don't hesitate to consult a healthcare professional as soon as possible. By recognizing these signs of blood clots in the legs, you're taking an essential step toward protecting your health and well-being. It's all about staying informed and proactive. While not every ache, twinge, or swell points to a blood clot, it's always better to err on the side of caution. Your body knows when something feels off, so if you notice any of these symptoms, whether it's swelling, warmth, tenderness, or those alarming feelings of heaviness or fatigue, don't hesitate to reach out to a healthcare provider for a thorough evaluation. Remember, early intervention can be life-saving, and the awareness you cultivate can truly make a significant difference. It's all about understanding your body and taking the necessary steps to ensure you're in the best possible health. Don't let uncertainty linger. Being proactive today can lead to a healthier tomorrow. Thank you so much for watching. If you found this information helpful, please consider sharing it with friends and family, as awareness is key to preventing serious health issues. Don't forget to like, subscribe, and hit that notification bell so you can stay updated on more important health tips and information.